Public health is very important, though people don't always realize it, because from the minute you wake up in the morning to the time you go to bed, public health really affects every single aspect of your life.
Public health is a growing and dynamic field. There's many health problems and conditions.
You are able to work in multiple sectors within healthcare, at the local level, at the national level, at the international level.
Public health to me is promoting the health for others.
Waking up in the morning, brushing your teeth, that's dental hygiene. That's something public health promotes. So having smoke alarms in your house, wearing seat belts to prevent, motor vehicle injuries.
Public health actually focuses on prevention. So what kind of behaviors can you do to prevent these health problems that might exist later in life?
Coming to work, having a safe workplace, reducing workplace stress, having maybe a wellness program at work.
It's kind of the art of preventing it so it doesn't get worse later down the line.
It really does affect every single aspect of one's life. The program actually got started because our dean, Dean Matthew Adianu, he has a background in public health, and he kind of really wanted to get a public health program started off the ground. And we're actually one of the very few programs in the country that even do public health at the undergraduate level.
It's a growing field, and particularly Ferris is actually focusing on rural public health. So being that we are in a rural area, there's needs that people that live in this area have in terms of access to health care.
Another reason is because we have, basically this is a rural area, so our focus is also rural health disparities. Health to me is a really interdisciplinary field, and we have 5 main domains of public health. So first we have health promotion and health education, also kind of known as social and behavioral sciences. Next we have epidemiology, which is also known as the study of diseases. And along with that we have biostatistics. Then we have environmental health and safety. And finally we have health administration and policy.
For students that are interested in the public health program, it gives you the opportunity to use your own desire to care for people and bring in your own expertise and care for them in the way that you would want to care for them. So for example, if you're a nursing major and if you want to be in public health, you could use your nursing background and become a public health nurse.
This lady came and talked to us, and she works for the health department here in Big Rapids, and she works in a whole bunch of different communities, and she does a million different jobs, like going to schools, helping students.
The biggest benefit for the program, I feel like, is educational. It's education and informative to not only just the students, but the students can go outside and help their family or help anybody else with whatever profession that they choose.
If you're somebody who's more math inclined or more number inclined, you could get into a biostatistics degree and get into more kind of research.
She works in getting vaccines ready if there's ever an emergency. She does a whole bunch of different stuff and wears a million different hats in the health field, and I think that's really awesome.
Public health can give students the opportunity to go into entry-level careers such as public health education, health promotion, environmental health specialist, nutrition, health informatics, global health, maternal and child health, and health economics, just to name a few.
If you're somebody who's administration inclined, you could get into health administration and you could care for, provide administration in any kind of a healthcare facility, ranging from a local health department, which is the smallest unit of providing care, to something as big as a tertiary care healthcare facility. And there are CEOs of large hospitals that have public health degrees, and that has helped them get there.
I'm a freshman, so I haven't decided exactly what I want to do, but I know I want to help others in as many ways as possible. I switched from dental hygiene to public health because I just didn't think I wanted to do the same thing every day, being in someone's mouth. I was very interested in it, but then I'm just like, I want something different. I want something where I can help broader people, and just doing something new every day would be really cool.
There's nothing more satisfying than helping somebody else, whether they are in need or not. Just giving them that helping hand, because I understand firsthand what it's like to not have somebody to help you out.
The world needs public health practitioners at a global level, is because diseases have no boundaries anymore. Diseases travel. We've become a smaller community. The world has become a village, so pretty much what happens in your backyard will be happening in the other person's backyard too. a few thousand miles away from here. So.
I chose public health because my family, there's a lot of chronic illnesses. My sister was born with arthritis and still suffers with it, and my mom has fibromyalgia. And so I really want to help people with chronic illnesses, and so that's what interested me. And then Dr. Wakil and the other staff members are very welcoming.
But for me personally, I think what I enjoy most about public health is just being able to work with different people from different fields. It's very interdisciplinary, it's very collaborative, and I really enjoy that experience and the process.
You can be confident that your skills are transferable and used in a different setting, which is why I think the world needs public health.